Why on earth isn't there more being said about this statistic right here? This is a conversation that we need to be having with ladies. This is a conversation we need to be having with families, that 50 to 70% of all breast cancers are preventable from the Physicians Committee for Responsible Medicine. Where do you hear that at? You don't hear that very often. And that's the conversation that we need to have today. The CDC, they say that around 80% of lung cancers are preventable. The CDC says this. So we've got the World Health Organization says around 30 to 50% of all cancers are preventable. You've got the American Cancer Society says around 40% of all cancers are preventable. And there's a lot of modifiable risk factors, things you and I can do. And then you have the Physicians Committee for Responsible Medicine. These are all medical and physician kind of organizations out here, and they're all singing the same tune. And so anywhere from 50 to 70% of breast cancers from this Physician Committee for Responsible Medicine show that breast cancer is preventable, 50, 70%. Super, super cool. So we need to have some discussions about things that you and I can do that some of these organizations, they agree with as well. They agree to it. Things you and I can do today to actually prevent cancers, in particular, talk a little bit more about breast cancer, but cancer in particular, and why we can't just rely on screenings and treatment. That is what has been promoted for a very long time. Screenings, and then screenings for the sake of treatment. We need to change the paradigm, change the thinking, so we're not just screening for the sake of treatment, but actually doing some things that actually help to prevent the conditions from occurring to begin with. And then also the question we're going to also talk about here today is, does sugar cause cancer?